I was literally itching my eye before this read, no joke. I didn't even think about it. If you're noticing, by the way, sniffles, itches, tickles lately, according to some doctors, we're in the thick of a nasty allergy season right now. Christian Garzone filed this report earlier today on what you can do to lessen the impact of the high pollen count.
Dr. Peter Capuselli says if you've noticed your allergies bothering you a bit more this year, it's been a pretty bad allergy season thus far.
Actually, the springtime is often one of the worst allergy seasons that we see regardless of the year.
He says we are in the thick of the tree pollen bloom.
Definitely start seeing some pollen on your cars, pollen on the ground. That's all really coming from the trees, and very soon we'll start getting into the grass pollen season.
If you have the itchy eyes, the runny nose, well, if you have allergies, you know. The good doctor says, though, there are some things you can do.
You can absolutely start with some of the over-the-counter medicine that are offered,
like oral antihistamine pills and nasal sprays. But if those don't work,
we would absolutely recommend coming to see an allergist and we can discuss other therapies.
He says allergies can also make people fear they have COVID symptoms. But to be sure, get tested.
But with the factor of COVID, it's always good to be thorough about making sure that's not playing a role before you then blame that all on allergies.
In Rochester, Christian Garzone, News 8.